Now, if you ask an Irish person what they'd like to change about themselves, lots of them would say their teeth. So today we have Dr. Buckley, CEO of Clearbraces.ie, to talk us through a process which involves invisible braces. We also have a very happy customer and a soon-to-be happy customer as well. Barry, you're very welcome to the show. You're all very welcome to the show. What is Invisalign, first of all?
Invisalign, essentially, is computers applied to the science of moving teeth. It's a series of invisible trays. I have one here. They're called aligners. And we utilize a very specific software program to design how we want to move, say, Amy's teeth from where they are now to where we specifically want them to go. And we use a series of these clear plastic aligners to get from A to B.
No, the technology isn't inside here.
No.
This is only plastic.
Absolutely.
Plastic, like, say, people, if they wanted to whiten their teeth, something like that.
Very similar. Yeah, very similar to that. And it looks like that in the mouth. It's very invisible, which is why people like it. It's very discreet. But it's extremely accurate and it's extremely effective.
So how many of these would a person have to use then during the course of the whole treatment?
Well, it would depend on how bad their teeth were. Okay. So a lot of people make the mistake of thinking that a procedure like Invisalign can only be utilized on, easy cases or very mild overcrowding. But the truth is you can use Invisalign on pretty much any case. So if you had a very difficult case, if the teeth were very crooked or very, crowded, then it might take 2 years, 2.5 years.
Okay.
But if it was very simple or very mild, it might only take 6 months.
And why are people going for this type of treatment as opposed to the regular train tracks?
Well, you know what, I suppose it all boils down to customer demand, right? Nobody really wants to wear train tracks nowadays, so they'd rather go for this simply because of discretion. But on top of that, if you have braces, a lot of kids will tell you they get food stuck in them, they're quite unhygienic. This has been proven to be a lot more hygienic than braces because you take them out to eat. Okay. So you wear these 24 hours a day, except when you're eating.
So you brush your teeth after eating again,
exactly.
And you put it back on
and you
again.
Pop them back in again.
Okay. And tell me then about Clearbraces. Who are Clearbraces?
So Clearbraces.ie is a set of dentists from around the country who are specifically selected and trained, who are very experienced at Invisalign. So we came together and we formed the website so that the public can know where they can find somebody like us that has a lot of cases behind us. And that's what the website is Clearbraces.ie. What we do is we do a lot of Invisalign. And we're probably the most experienced providers of Invisalign in the country.
We have Amy here. Amy, show me your teeth. Nothing wrong with them. Why are you unhappy with your teeth?
I think I work as a makeup artist. I'm always very up close with clients. And I first found out about it from having worked with a lot of the Irish celebrities who actually had them in. And half the time I didn't even know until they told me. So for me, it's about getting a bigger, wider smile and then pushing my 2 teeth back to reduce the prominence. So once I saw how efficient they were in other people, I said, oh God, I have to get them. So I went along for my free consultation and we'll be getting them in about 5 weeks.
And you don't see any big problem here at all?
No, this is a very standard thing. And actually, one of the benefits of Invisalign is we like to call it dentistry by design. So we can take someone like Amy, who's obviously a very pretty girl, right? And we can slowly move the teeth until we get them to a position that we think absolutely suits her, and then we can stop. So we get a lot of girls who want a wider smile, or maybe they feel their teeth are a little bit too prominent. It's very much a standard thing that we do.
I think we can take a look at Amy's scan here now. Yeah, so basically, Amy comes in first day, so you take a picture, and then you move the teeth to where you want
we
it to be.
We take either a digital scan or we take an impression the way you would have had it in the past, and then we use a computer program to digitally move the teeth from where they are now to where they want to go. And we call it a clean check.
So we have a before and after on screen there as well. Yeah. And is it up to the client as well, how much she or he would like them moved as well?
Absolutely. So the very first conversation we have with Amy is, what do you want to do with your teeth? We don't like to force anybody, and 90% of our clients are adults. Right, so they may not be worried about teeth at the back of the mouth. They're only very concerned about the ones right at the front,
the ones that people see.
Exactly.
Yeah. And what age can you get this?
Well, you can actually treat anyone from 13. Our eldest patient, believe it or not, is 72.
72.
Yeah. Fair
play, 72 years of age.
Yeah.
And so how long will it take Amy's teeth then to be happy with?
Amy's teeth, I think maybe 10 months, Dahi.
10 months.
As long as she follows the track and we don't run into any problems, about 10 months.
I think it's just amazing that it's in one sense, it's a simple piece of plastic, but it's the technology behind the whole thing that makes the piece of plastic work.
Exactly, yeah.
And there's no kind of it's not painful at all or anything?
Well, I mean, you're going to speak to Joanne later, who's actually gone through the treatment, but every one of our patients would say the same thing. It's a little bit tight when you put it in at the start, but after the first week, there's no pain. I've actually worn these myself, and I've gone through the treatment myself, and I can say for the first 4 or 5 days it was a little uncomfortable, and then it's an absolute walk in the park.
Well, when you see the end result, I think you'll take 1 or 2 days of discomfort.
Yeah, exactly.
Now, lots of celebs are getting them done at the moment.
Yeah, well, I mean, if you look worldwide, I mean, this treatment has been going on since the year 2000, it's not new. So if you look at famous people, the Kardashians have had them. You know, Desperate Housewives, Eva Longoria has had them, and even in Ireland, you can look at some of the local celebrities who have had them. Keith Duffy's had them. I know he's a patient of mine, so I can say that he's okay with that.
He's okay with all that.
Yeah, and there's a lot of other Irish celebrities that have had them throughout the last 5 or 10 years.
So Amy is just beginning the process, but Joanna, how long have you been getting this process?
8 months now.
8 months.
Yeah, and at the very last week.
In the beginning, did you find a small bit of discomfort in the beginning?
Yeah, the first
but nothing
days.
too bad.
No, it's like a pressure on your teeth. And I was actually expecting every time I change the aligners to have that pressure, and it's only very, very slight. It's not painful at all.
And you're actually wearing them at the moment. Can we get a tight shot there, Joanne?
Yeah.
You wouldn't, the thing I really like about these, Barry, you wouldn't cop it at all.
No, you know, I mean, the customer's always right, isn't it? And essentially this is born from a need from the customer saying, we do not want to wear braces and we want to move our teeth with discretion. And this is what Invisalign gives people the choice to do. So you can see she's wearing them now. There's nothing like seeing actually somebody wearing them in the mouth. And even you're this close, you wouldn't notice unless we told you.
And you have top and bottom there as well, no?
Both.
Yeah, at the same time. So you just take them out when you're eating, as Barry said.
Yeah, and then back in, you brush your teeth, put them back in, and like ideally you'd want to be wearing them for 21, 22 hours a day. That's what I did anyway, and I flew through the treatment.
And you're a very busy mom, of course, as well.
I do. I have 3 young kids at home.
3 young kids, so I'd imagine.
And a 4th on the way.
And one on the way. So for a busy mom, you didn't take any notice. You popped them in every day, and that was it.
No, that was the beauty of Clearbraces, though. The appointments were so flexible for me. I could go every couple of months as opposed to every month with the normal train tracks. It was just ideal for me in every situation.
Can we see the before and after of Joanne's? Can we? We can. So there's before. So you look at this, Barry, you say, OK, how long will this take? You'd have a fair idea in your own head, I'd imagine, would you?
9 or 10 months, and in actual fact, it was exactly that in the end, wasn't it, Joanne? It was 9 months?
It was 8 months, actually.
8 months, yeah.
If we can see the before picture there again, just the bottom teeth there. So there's a fair bit of work to be done there, wasn't there?
Yeah.
So if we can just see there now again, and they're, after 8 months, they've straightened out.
Yeah, they're absolutely perfect.
And how many different things did you have to put in?
Well, it was every 2 weeks.
Yeah,
Every 2 weeks.
2 times 16, 17 aligners. It's hard to believe when you see it. And when you see teeth that are that crooked, you think to yourself, how is a sheet of plastic going to move them into this kind of a
I want to see
position?
that. Can I see those bottom teeth again there, please? Yes. So, and can I see your teeth now, please? Just your bottom teeth there again. There is a huge difference there.
Well, they're perfect.
They're perfect.
They're 100% perfect. And so people sometimes get this confused. They think, is it as good as braces? It's the very same. It's the very same as train tracks. It's just Joanne chose to go down the Invisalign route as opposed to putting braces on her teeth.
And are they expensive?
Well, normally they can. It depends on where you go. With the group that we're part of, we have a set fee because we do so much of it. We get a discount from the company. So it's usually around $4,000. But actually, the reason we're here today is because we have a promotion with €500 off.
€500 off.
Yes.
Dr. Buckley, thank you very much.
You're very welcome.
Joanne and Amy, thank you very much for coming in. Let me take a look at those teeth again. With the bottom teeth again. I'm surprised. I'm not surprised. They're brilliant. Fair play. And of course, more information can be found on this treatment. And of course, as Barry said, there's a special offer if you go to Clearbraces.ie. Over to you, Maura.